Hi, my name is Dr. Mark Pimentel. I'm presenting on behalf of our authors, and specifically Gabriela Leite, on this topic of hydrogen sulfide and its relationship to gastroesophageal reflux disease here at the American College of Gastroenterology 2025 in Phoenix, Arizona. So recently at DDW, we presented the first, or one of the first, studies of the small bowel microbiome in relationship to gastroesophageal reflux disease. And interestingly, we found that a microbe, Belophylla wadsworthii, was associated with reflux disease. We know Belophylla produces hydrogen sulfide. Hydrogen sulfide, we know, can reduce lower esophageal sphincter pressure. So this relationship between Belophylla, the potential for hydrogen sulfide, and its role in GERD needed further exploration, hence this study. This study was part of a larger study of 6,000 patients that had undergone breath testing. During that study, 6,000 patients were administered a home breath test kit, TrioSmart, which encompasses hydrogen, methane, and hydrogen sulfide. They were also given a questionnaire to complete. The patients completed the breath test as breath tests are normally conducted, where they had a fasting breath sample followed by breath every 15 minutes after either lactulose or glucose. When the breath test was complete, the questionnaires were also completed. They were packaged and sent back for analysis. So, results. Out of 6,000 patients, 3,029 actually completed the entire breath test and comprehensively completed the questionnaire. Using this data, we were able to divide subjects into three categories. People with GERD who still had GERD, but were on a PPI, and people who were on a PPI for GERD and the GERD was no longer a symptom. In addition to that, we were able to find patients who had no GERD and no PPI as the control group. And regardless of which of the three groups with GERD were looked at, all three had elevations in hydrogen sulfide in comparison to the control group. The patients with most elevation were the patients who were no longer having GERD, who had PPI administered. The final part of the results, which was very interesting, was that one of the symptoms in the questionnaire was burning of the esophagus on a visual analog scale. The more burning seen, the more hydrogen sulfide was seen on the breath test. So now taking this from the initial information on Belophylla being associated with GERD from DDW, and Belophylla being a hydrogen sulfide producer, we can now say here that GERD is associated with hydrogen sulfide on breath test. Not just that, but that the degree of symptoms of burning in the esophagus was associated with the degree of hydrogen sulfide. While this does not prove cause and effect, it implies that further research is needed to look into this and to see whether hydrogen sulfide is in fact playing a pathophysiological role in gastroesophageal reflux disease. Thank you so much for listening to me present this abstract. We hope you enjoy ACG 2025. As you can see, we have some interesting abstracts at this meeting, and we look forward to meeting you there.